All right, a very good morning to all of you, ladies and gentlemen, and welcome to this 3-day event, Unlocking the Power of Being. Healing Self and Others, organized by the one and only Mental Health Foundation India in association with Department of Psychiatry, AIIMS, New Delhi, and RAHAT Charitable and Medical Research Trust. Well, the theme for this event is spirituality as a means to enhance the mental well-being in medical students and healthcare professionals. But why are we focusing on medical students and health professionals? Well, the question is apt because the doctors, nurses, and other healthcare facilitators have long considered their jobs to be a calling, and they usually are very enthusiastic about this, entering this field with a high sense and a hope of helping people and healing them. Now, the evidence suggests that almost 80% of our doctors, especially the Indian doctors and physicians, go through depression. Then you go 17% that have thoughts of ending their life. Now, this is serious because until and unless you don't heal yourself and help yourself, how will you help others? Now, there is definitely a need for instilling in students an empathetic and positive attitude, medical ethics, professionalism, communication, and leadership skills, as well as encouraging a spirit of lifelong learning. Right from the first professional year till the time they continue the practice. By virtue of its nature of self-reflection and self-awareness, spirituality, apart from knowledge of mental health, and maybe a way of achieving their goals and goals beyond that. Thus, we bring to you this fabulous program, and I call it a summit because it is a summit. We are going to put editions and editions of positivity with the kind of dignitaries and speakers that we have. For the next 3 days, you will surely be ready for the next 100 decades. That is how much positivity we are about to spread. But before that, I'd like to thank all our sponsors. First and foremost, our platinum sponsors, Vakrangi, Gale India Limited, Interpress Gas Limited, Intas Pharmaceuticals, gold sponsors, Sham Steel, Sun Pharmaceuticals Industries Limited, and silver sponsors, Cipla Limited, Lupin Limited, technical partners, Hums Events. So let's have a huge round of applause for our sponsors. एक बारी जोरदार तालियां जहां पे भी है जैसे भी है. We need to get this energy going, and that is how it is all about. Okay, with that being said, ladies and gentlemen, it is my utmost honor that we have such international celebrities and dignitaries amongst us. A big thank you to all of you for giving us your precious time. First and foremost, I would request Dr. Sanjay Kumar, Secretary, MHF, to kindly felicitate Professor Randeep Guleria ji, Director, AIIMS, New Delhi. Can we have a round of applause for Sir? Thank you, Sir, for giving us your precious time. Indeed, a very important day. So there we have Dr. Sanjay Kumarji. And a big thank you to Professor Randeep Guleria ji. Thank you, sir. And now I would request the Chairperson, RAHAT Charitable and Medical Research Trust, Dr. Sujatha D. Sharma ji, to please felicitate Professor R.K. Chadda, Head of Department of Psychiatry, AIIMS, New Delhi. A big thank you to both of you gentlemen, and of course to the ones who felicitated. Ladies and gentlemen, हर शुभ काम का आगाज दीप प्रज्वलित करके किया जाता है. And this time, since we are taking this summit globally, so what we are going to do, we are going to do a hybrid mode of lamp lighting. So I would request our dignitaries to kindly do the honors and do the lamp lighting, so that we presented this burning lamp as a symbol of peace and positivity, spreading brightness all across the globe. जितने लोग यहाँ पर अटेंड कर रहे हैं, आपसे गुजारिश है अपने रूम में ही तालियां बजा लीजिए. We all have embarked upon something really spectacular and fabulous, spreading positivity, peace, and healing all across the globe. Once again, I would like to welcome each and every one of our participants, all our attendees and all our dignitaries. A big thank you. अगर आप लोगों की हो इनकी स्माइलिंग शक्ल नहीं नजर आ रही, वो इसीलिए है क्योंकि इन्होंने मास्क पहना हुआ है. You see, at the end of the day, we all are doctors and medical people. We need to take care of security. Well, talking about वायरस फैलता गया है बट उसको कंट्रोल में भी आ गया है और हम इस बारी वायरस फैलाएंगे पॉजिटिविटी का, because this is something that each and every one should actually be ready to receive, because positivity and healing yourself and healing others is of the utmost essence and importance, especially at these times. So now I would present one of the ever-smiling personalities of our family. He has more than 80 publications to his name and is an ingenious researcher. His love for innovating has been instrumental in bringing about a difference in mental health practice and research in India. He has also mentored development of first indigenous web portal, Me Hope, exclusively for mental health in India. Now that's really important. And he started the first e-Hindi magazine called Mansik Swasthya Patrika for the promotion of mental health and to address mental health issues of the community in the Hindi-speaking area. Ladies and gentlemen, with a thunderous round of applause, let's invite Professor Nan Kumarji, President, Mental Health Foundation India, and Professor, Department of Psychiatry, and in charge, Neuromodulation and Mental Health, AIIMS, New Delhi, India. Welcome, sir. Zordar taaliyan for sir.
Thank you. Thank you very much. My warm greetings and welcome to everyone here. Our Honorable Director, Prof. Guleria, sir, our Head of Department of Psychiatry and Chief, National Drug Dependence Treatment Center, Rakesh, Chadda. President, Indian Psychiatric Society, Dr. Gautam, Saha, who is in online mode, and President, Indian Medical Association, Dr. A. Jayalal, is also in online mode, and Dr. Sujatha D. Sharma, Trustee of the RAHAT Charitable Trust, and General Secretary and Executive Head of MHF, Dr. Sanjay Kumar, and Dr. Professor Gangadhar is on the flight, so he will be joining us for inaugural talk at 11 o'clock. So welcome to him also. And most important, I welcome all our virtually connected dear friends and colleagues that we can't see, but we can feel your presence here. So the journey of celebration of this Mental Health Week and Day by the Mental Health Foundation started since 2014 in association with Department of Psychiatry, AIIMS, and that is only possible because of the support of the head of department, Professor R.K. Chadda, sir. And this year it is the 8th consecutive program being organized by the Mental Health Foundation with support from Professor R.K. Chadda, our Head of Department of Psychiatry and Chief of National Drug Dependence Treatment Center, and of course with colleagues and friends in the department and Mental Health Foundation. The successful organization of any program, especially in the COVID time, is only possible with a very unconditional support from our director, Professor Randeep Guleria, sir, who always manages time for us despite his extremely busy schedule. And somebody has written very nicely, I think only for him, that only busy people can manage time. He was in the boardroom now he is here. And after that, he has a lot of other programs. Dr. Sagar is preparing some talk. He had discussed something with sir also. So he is so busy, but he always manages time with his smiling face. Perhaps a true spiritual nature of sir. This year, on the occasion of World Mental Health Week and Day, we are organizing 3-day virtual program with the title of Unlocking the Power of Being, that is healing self and others. Because as a human, as a doctors, we all know that we need to heal ourselves also to heal others. So it is a very important program. This is mainly for the general medical students, in fact, and the professionals, but also general people can log in and perhaps take advantage of this program. The entire 3 days program will focus on medical education, mental health, and spirituality, in which we are going to exchange our views and a lot of information with each other, focusing on various aspects of mental health of the healers and spiritual perspective of healing self and others. I personally feel that with changing time and socio-cultural structure, we need to redefine the spirituality. Spirituality has nothing to do with religion and rituals. I think spirituality is not only meditation and mindfulness also, that is perhaps promoted since at least last decade. I feel personally that spirituality is basically awareness of the self, self-discipline, power and a strength to communicate with our own self and others with empathy. That is basically spirituality that we need to perhaps understand. And in medical science, little healing with non-verbal communication with patients or anyone, I think that is a spiritual gesture. And I can give you one example. There are a lot of clinicians, they have the same degree, same book they have read, same prescription they prescribe, but they have the healing touch. One of the example is our director itself. I have seen people coming with voluminous prescription papers and with lot of problem with no prescription from so many also pulmonary medicine consultant. You look at the paper, he just smiles and just see, and okay, at times he makes some small changes, or at times he ensures, okay, everything is fine. And the patient feels better, in fact. And usually they say, okay, now I will be fine because I have seen you. So that is a spiritual gesture that we as a medical professional, in fact, need to understand. So once again, very deep gratitudes for being part of the journey from 2014 onwards. And it is needless to say that the Mental Health Foundation is able to do these activities only because of the unconditional support from our sponsors, like what in introduction it has been mentioned, Wakrangi Group, GAIL, Indraprastha Gas Limited, Intas Pharma, Sun Pharmaceuticals, Torrent, Lupin, and Sharma Steel. With this, I welcome you all with very, very warm greetings. Thank you.
Big thank you to Professor Nan Kumarji. Thank you, sir, for starting this fabulous summit. Now, ladies and gentlemen, it's time to invite the ever-smiling personality. She is a practicing consultant, clinical psychologist in New Delhi, and has been working with all age groups with psychological distress and emotional well-being issues for more than 3 decades. Apart from being the chairperson of RAHAT, she is the founder and director of Mind Specialists and Better Minds. Her consulting and training has specialities including promoting wellness behavior, stress management, life skills for children and parenting, handling relationships, public education, awareness, trauma counseling, and spiritual counseling. Ladies and gentlemen, please put your hands together for Dr. Sujatha D. Sharma, Chairperson, RAHAT Charitable and Medical Research Trust.
Thank you. It's my proud privilege to be here today as a part of this wonderful 3-day feast that we are going to be having, and led by MHFI and AIIMS. RAHAT is also privileged to be a part of organizing of this event. And just to touch upon briefly about RAHAT, RAHAT has been in existence almost for 3 decades now, and is a pioneer in the field, an NGO, non-profit, working in the field of mental health for, and its main aims and objectives have been to foster community awareness, education, training on mental health issues through various campaigns, workshops, educational programs in schools, colleges. So that is a kind of work that we have been doing and conducting for these last 30 odd years. And in the last few years, our initiatives have been around, mainly around 3 areas. One is setting up a resource portal on mental health called Mind Specialists. And for all of you who are interested, please do log on to this website. It's there in the registration brochure. It has a lot of information and self-assessment. It has got podcast videos and a whole lot of educational information for mental health issues. The second area that we have been successfully conducting is in the area of community education and mental health awareness and training through training of NGOs working in the field on mental health issues. And we have successfully trained training of the trainers programs, and until COVID had to stop a lot of our on-ground work. And the unique part of this program has been using innovative educational tools as a form of infotainment and using them in the field for ground field workers to get trained in mental health and identify cases in the community. And the third important aspect or initiative has been to develop a module to help youth and students and young people develop skills to recognize, handle as peer educators and helpers, caregivers in the field of mental health by sensitizing them to mental health issues and providing the skills to offer support, psychosocial support. So it's called the YES program, Youth for Emotional and Psychosocial Support, which we launched, but we are yet to take it off because we're going to be waiting for the universities and colleges to reopen to do these online training programs. So this is the kind of work we have done. And like I said, RAHAT has been a part of this event, organizing it. And I'd like to underscore the importance of this event, because I think it's absolutely a unique event. I don't think we have had events for medical students, undergraduates, graduate training programs, paramedical professionals, health professionals in general, which touches upon aspects of helping them build resiliency, coping skills to handle their own psychosocial problems, their emotional problems, because we know that medical students and healthcare professionals have been the most under stress, especially in the post-COVID and the post-COVID world that we are facing today. They have, even otherwise, we know that medical graduate students go through a lot of stress during their training programs, their educational aspects of the academic life. And as already shared, we know that about 30% of medical students are prone to depression, and about 17% have actually had thoughts of suicide. We have 80% who are facing stress and burnout issues. So it is a very, it's a need of the hour and an ideal time for us to address these issues through topics related to how to enhance their individual coping skills and individual resiliency skills, interpersonal skills, communication skills, empathy skills, and a whole range of skill building that is encouched in a framework of spirituality, values, ethics, and that would be the good framework that would help these students to unlock their inner potential and touch base with their core. And the idea of this program was that we have in the next 3 days an array of luminaries, lay speakers, international and national, and we have speakers from 3 continents actually, from the US, UK, and Australia. And we have our own speakers of eminence from India who are going to cover an array of topics from, like I mentioned already about spirituality, coping, stress management, communication, empathy building, handling emotions, emotional intelligence. So it's really a feast for the mind that is going to be highly stimulating. And we all will look forward to this great event, interactions in the next 3 days. And I do urge all of you to be a part of it and take as much benefit from it for the coming days, and to build your own to touch with your own inner core. It's not enough to be brilliant academicians, good clinicians. We have to be good, at the end of the day, we have to be good human beings who are compassionate, caring towards, not only for their own self, to the people, the patients whom they care, and to people around them. So get ready to unlock your inner power of being, and welcome to this program. Thank you so much.
Big thank you to Dr. Sujatha Sharma ji. Ladies and gentlemen, moving on, we have a very special message from a very prominent well-being psychiatrist with over 40 years of practice in Delhi. He's the founder and director of Mind Specialists and Better Minds. He has been the international lead on public education for the World Psychiatric Association, WPA, and is the co-chair of the WPA section on spirituality and mental health. Dr. Sharma has also served other reputed positions nationally and internationally, such as chair of the Public Education and Awareness Committee of Indian Psychiatric Society, International Distinguished Fellow of American Psychiatric Association, to enlist a few. He has been awarded for Sadhana Kala Award, Gem of India, Medical Excellence Award, Rashtriya Gaurav Award, T.P. Jhunjhunwala Foundation's 24th National Excellence Award for Medicine, Health Oscar of India, and many more. Ladies and gentlemen, here we come with a very special heartfelt message from Dr. Avdej Sharma, Managing Trustee, RAHAT Charitable and Medical Research Trust.
So please speak. It will get you. No, just read. Just read.
Audio is not there.
Well, ladies and gentlemen, the message will be relayed.
Due to some personal reasons, I'm not able to be with you on this very, very auspicious occasion of 3 days of unlocking the power of being. It's a wonderful opportunity for all of us, not only for now, but to learn some of the things that are going on in the world in terms of healing, health, and harmony and well-being for the coming decades. And we are learning this, we are discussing this with some of the best known masters of the world. We don't have enough professionals, whether in big cities, resourceful cities, countries, or in remote places. And yet we have to tackle various kinds of health issues that are emerging and are likely to keep emerging. So the trick is for us to share our knowledge, to be in harmony, which actually now is a possibility because of the various kinds of new information that is coming in, which is changing us at our cellular level, at our social level, at our well-being level. And if it happens from health professionals, if they start being the harbingers of change, if they bring about changes in their lives and they can show it to the world, then this world will be a much, much better place to live in, not only once an illness has arisen, but also before it has arisen. So welcome on this journey of unlocking the power of being, a program on wellness which will keep evolving over time, which will become a part of the curriculum of medical colleges and schools across the world, and where we would be sharing the knowledge at all platforms. And we invite you on this journey of unlocking the power of being. Thank you.
Big thank you to Dr. Rakesh Sharma ji. Ladies and gentlemen, up next we have Professor Rakesh Kumar Chadda, who is also the Chief of National Drug Dependence Treatment Center, AIIMS, New Delhi. He is the Secretary General of World Association of Social Psychiatry. He is a Distinguished International Fellow of the American Psychiatric Association and is also a Fellow of the Royal College of Psychiatrics of UK and the National Academy of Medical Sciences. Professor Chadda has more than 175 publications to his credit, including 4 fabulous books. So over to you, sir. Welcome.
Good morning. It gives me great pleasure to be here on the occasion of 3 days program being organized by the Mental Health Foundation in collaboration with RAHAT Trust and the Department of Psychiatry and National Drug Dependence Treatment Center, All India Institute of Medical Sciences, New Delhi. Professor Randeep Guleria, Director AIIMS is here, Dr. Sujatha Sharma, and many of the dignitaries are there on in virtual connection. As we all know, mental health is an integral component of health. Though the World Health Organization had recognized its importance more than 70 years ago while introducing the concept of health, mental health as well as mental illnesses have often remained in the backyard of health services all around the world. In fact, the mental health care units, which replaced the mental hospitals all over the world after the introduction of the antipsychotics, they still remain on the outskirts of the general hospitals, even in the Western world. Though in India, we have been fortunate that psychiatry units have often been integral part of the general hospitals, like at AIIMS also, which started, I think, which was probably the first integral psychiatry unit in the general hospital. Despite this stigma to mental health, mental illnesses exist all over the world, despite availability of treatments of efficacy, all treatments of efficacy equivalent to those for the medical illnesses. We all know after the results of the World Bank sponsored and WHO's study on global burden of disease came out with the finding that in the early 1990s that mental disorders are a leading contributor to the global burden of disease and associated disability. In the recent past, COVID-19 has brought further focus on need to take care of mental health with the profound mental health morbidity associated with the pandemic. Even the mental health, the medical health professionals who are taking care of the persons with COVID problems suffered a lot, and they also suffered mental health issues. And as has been already pointed out, the medical students as well as doctors, they also have often mental health problems, which is much higher than the general public, and they also often ignore. Suicide rates are also higher in the medical students as well as the health professionals. There is a need to take care of one's mental health, which we often ignore, and especially we need to focus on the mental health care to everyone who needs it. Some of the basic principles of mental health promotion include lifestyle modification, regular schedule of physical exercise, adequate sleep, maintaining communication, and staying away from alcohol and drugs. Recent advances in the information technology and easy and availability of internet that has led to more, that should have brought, rather improved the mental health care, but it has brought reduced social communication. People are often confined to the IT devices, mobile phones, and the virtual world, which has had its adverse consequences on the mental health of all the public, including the health professionals. So we need to take care of this new epidemic of IT devices or the internet disorder has been now well recognized as a new emerging illness and has been taken in the DSM-5 also. Some of the basic principles of mental health, which have been given in our ancient literature, including yoga, spirituality, meditation, have also an important role in mental health promotion. So we should not shy away from these our ancient practices. Spirituality remains one of the important methods of dealing with the mental health crisis. And the health professionals also need to, I think, take care of their own mental health, and should because unless they take care of their own mental health, they can't provide guidance and mental health promotion amongst their patients. So this is a message I would like to give in this brief talk, and I congratulate Dr. Nan Kumar and RAHAT Trust for organizing this 3-day event on the occasion of the World Mental Health Day. Thank you.
A big thank you to Professor R.K. Chadda. Ladies and gentlemen, now we come to the personality who very much resides in the land of sweets, and especially when Navratri are on, definitely unki jo kehte hain aura is more and more positive and prominent. Up next, we have our speaker, Dr. Gautam Saha, who is the founder and director of Clinic Brain Neuropsychiatric Institute and Research Center, Barasat, Kolkata. Dr. Saha is the vice president of SARC, Federation of Psychiatry and Indian Association for Geriatric Mental Health, IAIIMS. And he has recently started a child and adolescent mental health services, which is a division of his institution for better management of these age groups, individuals with mental problems. So zordar taaliyon ke saath, let's invite Dr. Gautam Saha, President, Indian Psychiatric Society. Welcome, sir.
Thank you so much. Good morning, everybody. It's really a great privilege for me to be here among the galaxies of the fraternity of mental health. In fact, you know that we are in a very good time. In fact, it is the mental health week we are observing, and at the outset, I must congratulate the organizer like India AIIMS, New Delhi, and also the Department of Psychiatry, and also the RAHAT, organizing this jointly, and definitely the Mental Health Foundation, because you know that they are doing very good jobs in the always, and I'm really proud to be a part of it. My regards and respect to Dr. Guleria, Dr. Rakesh Chadda, Mrs. Sharma, and other guest of honors here, Dr. Afzal Javed, Dr. Jayalal, Dr. B.N. Gangadhar, and all the dignitaries are on the dais, and I mean offline also, those who are listening this. It is really great pleasure that this topic chosen by the organizer is really fantastic, and I must, at the initial part, show my gratefulness to be here. Two personalities, my elder brother, Dr. Abdesh Sharma, was a wonderful working on this field a long time, and Dr. Nan Kumarji from AIIMS, who is also very active and always very supportive. Whenever we do some work on behalf of Indian Psychiatric Society, he is always there and he is very active. The topic chosen by this committee is definitely one of the most important topics, that spirituality as a means to enhance the mental well-being in the students and healthcare professionals. In fact, as an Indian, I must say, spirituality comes spontaneously in our mind at the growing age, but in fact, there are lots of evidence-based data which showed that spirituality is equally important in young and adults in the student's life. You know that spirituality is the way you find meaning, hope, comfort, inner peace in your life. Many people find spirituality through religion. Some people find it through music, art, or a connection with the nature, and others find it in their values and principles. Spiritual well-being is one dimension of the health that provides a person with stability, meaning, fulfillment in life, and self-belief. University students are at that critical period in their lives, and that is characterized by individualization and the separation from the family, development of new social connection, increased autonomy, and the responsibility. People in this period face new challenges in education, social relationship, and the other fields too. And these changes lead to increased level of stress, adaptive and behavioral problems that can adversely impact their health. I mean, physical and mental health, both. And spiritual well-being is considered as a psychological resource of coping these situations that reduces the suffering and leads people to consider traumatic situation or disturbing events from the positive perspective. Although the health has been defined based on three physical, mental, and social dimensions for decades, but you know that Rashan and Osman included the spiritual dimension too in the definition of health. Spiritual well-being is a unique source of coordinates the physical, mental, social dimension, and it is characterized by stability in life, peace, adjustment, harmony, a sense of close relationship with oneself, God, society, environment. And you know that spiritual well-being consists of two components of the religious well-being and the existential well-being. So the main two components is religious and existential well-being. And religious well-being is a sign of communication with God, and existential well-being is the sense of purpose in life, peace, and life satisfaction. Spiritual well-being had an effect on the physical, social, psychological aspects of an individual's life. And you know, the university students in this period of life take more responsibility for their health and have a greater control over their lifestyle than the adolescents, which is the motive for doing this program today. The lifestyle changes can have a strong implication on their health of well-being. Furthermore, as mentioned by Dr. Chadda also, and furthermore, the mental health among university students could be affected by the spiritual well-being. Various studies investigated in the spiritual well-being of the university student. You know that Fiji et al. Found that the healthcare students had moderate spiritual well-being and showed a positive correlation between the happiness and the spiritual well-being among the healthcare students. Moreover, some studies like Alorani and others demonstrated that negative correlation between the spiritual well-being, depression, and aggression. And other studies like Mehri et al. Found that the significant relationship between the spiritual well-being and the health-promoting behavior. Moreover, one study in Jordan also showed that an association between spiritual well-being and better college adjustment among the university students. I mention all these data because there is evidence-based data which showed clearly that spirituality in fact helped in these students for developing, for coping strategies, for more resilient in this young age. The transition from adolescence to youth period causes the young people to face sensitive and critical situations. Concerning the role of spiritual well-being in improving the mental and physical well-being individual, it is necessary to improve spiritual well-being among the young people, especially the students. Since the medical science students are expected to be aware and practice healthy behavior, healthy lifestyle. And also the technological advantage of the past century tended to change the focus of medicine from a caring service oriented model to a technological cure oriented model. So caring model is more important than cure. Technology has led to phenomenological advantage in medicine and has given us the ability to prolong life. However, in past few decades, physicians have attempted to balance their care by reclaiming medicine more spiritual tools. Recognized until the modern times, the spirituality is often linked with the healthcare. One of the challenges of the physician faces to help the people find meaning and acceptance in the midst of suffering and chronic illness. At the same time, while the patients struggle with the physical aspects of their disease, they have other pain as well, pain related to mental and spiritual suffering, to an inability to engage the deepest question of life. The patient may asking the question such and following: why is this happening to me now? Why me? What will happen to me after I die? Will my family survive my loss? This pandemic area absolutely fingering those things in these our patients and also people and also in the society at large. Nevertheless, people long for their physician as well as their families and friends to sit with them and support them in their struggle. The healing requires answers to this question. Cure is not possible for many illnesses. In fact, if you ask me, except the infective diseases, there is no cure in other illnesses. I firmly believe there is always a room for healing. Healing can expect it as an acceptance of illness and peace in one's life. The healing, I believe, is at its core spiritual. You know that Erik Erikson has written about certain development tasks that he suggested children, adolescents, and the adults need to accomplish as a part of the normal developmental and mature processes. Spirituality has been recognized by many authors as an integral development task for those who are dying. Unfortunately, people who are dying are often ignored and neglected. As these patients deal with these issues of transition, and they need some to be present and them support them in the process. We need to advocate for the systems of care in which that can happen. So system of care is very important. There are other areas we have to take care of it, that research on the role of spirituality in the healthcare. And if you consider the mortality, some observational studies also suggest that who have regular spiritual practices tend to live longer. Another studies to possible mechanism is interleukin-C, which increase the level of interleukin-C associated with increased incidence of the disease. The author hypothesized that the religious commitment may improve stress control by offering better coping mechanism, richer social support, and the strength. And the coping is another coping and resilience, and recovery also is one of the, and the path to improve the health. If you want to improve your spiritual health, you may want to try following ideas. However, remember that everyone is different. What works, do what is comfortable. So in summary, spirituality can be important element in the way the patient face chronic illness, suffering, and loss. Physicians need to address to the alternative to all suffering of their patients, physical, emotional, and spiritual. Doing so is a part of delivery of the compassionate care. I think we can be better physicians and true partners of our patients living and in their dying. Even we can be a compassionate if we truly listen to their hopes, their fears, their belief, encourage these beliefs into the therapeutic plans. In fact, this caring model is very important, and the topic chosen by, again, I thank to the organizer for excellent choosing of topic, and thank you so much. I wish all the best for this next 2 days also. Thank you so much.
A big thank you to Dr. Saha for those very enlightening words. Ladies and gentlemen, as we move on, I'd request another personality from our family who continues to serve in the Health and Family Welfare Department as a medical officer since 1993. Professor Jayalal is the Professor of Surgery in Kumari Medical College. He also chairs the UNESCO Bioethics in India, holds a PhD degree from Vinayak Missions University, Tamil Nadu, and has obtained special training in minimally invasive laparoscopic surgery from various stalwarts in this field. Please put your hands together for Professor J.A. Jayalal, Honorable President, Indian Medical Association. Welcome, sir. Well, till the time we get connected with Professor J. Jayalal, you see all of these things are happening globally. And there we go. Welcome, sir.
And this was approved by all. Now,
My humble request to Professor J. Jayalal, sir, can you please switch on the icon of video? All right, there you go. Welcome, sir. Over to you.
Hello.
Yes, sir. You're audible. Whenever you would wish to go, the stage is yours.
Hello.
Professor Jayalal, sir, can you hear me?
Yes, I am able to hear you, sir.
Yes, sir. I've already announced you. Whenever you would like to address the gathering, you can please do that.
Yeah, I am able to hear you.
Yeah, can you please give us your insight as to...
Yes. Thank you very much for inviting me to be with you. I am right now in a meeting. That is why I just came out. It is a great honor to be with the mental health program of AIIMS and the Mental Health Foundation and the RAHAT Foundation. It is a great honor to be with you. Indian Medical Association also very much we are interested to carry on this project of Physician Heal Thyself. Physician, whenever we are burnt out, whenever we are stressed out, right, especially in the post-COVID era, there is a lot of issues of the mental health is prevailing. So we need a comprehensive approach and comprehensive healthcare provision for the doctors to get out of this. It is always true that we always serve for the others and we are focused to treat others, often forgetting about ourselves, our own needs and our own priorities. So we are putting it in a second thing. So that is why the most of the time the issues are coming. I firmly believe the concept of love yourself as you love your neighbor. This is the two concept which is often by the doctors. Loving others is taken very easily and very effectively they are doing. But love yourself is a big thing which is lacking among the doctor community. Unless a doctor is able to love himself with all his iniquities, with all his failures, with all his disappointments, he will not be able to execute the same kind of love and joy to others. So whenever a doctor is not satisfied inside his heart, inside his mind, his mental strength is not good, I think this whatever he is doing going to be is an artificial. So it is mandatorily not only for the selfish benefit of the doctors, but also for the benefit of the community. We build a positive environment, positive mental health among the doctors. I often have to tell to my students, in the life, never be serious, be sincere. The serious people has to be in the ICU. But when you are sincere, at the end of the day, that if you can say that I have done my job well, I am conscious to my heart and conscious to my mind that I am happy. I have done this satisfaction of my full health, and I am able to do this with the full passion and the might. And that is a great achievement a doctor can do. But if we are worried about the outcome and we are worried about the consciousness, consequently we are thinking about the outcome, definitely we will be serious and we will be in the ICU. So this concept of doing it according to your heart and mind has to be incorporated into the minds of the people. And we should also now teach the youngsters where they always feel it is like a computer game. Life is like a computer game where they can put delete button and go back. But ups and downs is mandatory requirements in the life. The ECG, when we look, only when there is a ups and downs are then we say that the patient is alive. When there is a flat line, we will not say that he is alive. So similarly, the ups and downs will be mandatory, and that will be always required in the life to go ahead. So that pathway of understanding and living in the both and ups and downs, top, hilltop and the valley, the concept has to be taught to our students, and it is only by the mentors. I'm so happy today NMC has brought in the comprehensive medical education, where we are talking about outcome module, where it was given in a hidden module. Now it is been an exposed module, which we are giving. So more and more our concept should be lead on to this issue. In Indian Medical Association, in all our CME programs, we insist that it is not only the cognitive skill you teach, but also the psychomotor and affective domain has to be comprehensively included in that issue. So I'm so happy that 3 days, the mental health, this program from the Premier Institute of AIIMS, you are organizing, and that is a wonderful benefit which you are going to give to the medical fraternity. IIMS is very much concerned about that. We get reports from every medical college in an average, at least in a year, 10 to 15 students, our own medical students, not only the undergraduate, even the postgraduates are committing suicide. And this is a big painful event, and we need to work on that. Not only that on one extreme of the suicide, but other extreme. We find the lack of confidence, lack of esteem, self-annihilation, self-destruction, and that is on that one spectrum. And the third spectrum we are seeing is a drug addiction and addicted to alcohol, addicted to those sexual issues. And that is another aspect. So all this encompasses on the mental health, where there is a positive things are talking. When we talk about the holistic word, many people think that we are talking in terms of Ayurveda or in terms of other people. Holistic health is a buzzword of our modern medicine. The WHO definition also very, very effectively saying. So many times when the modern medical persons are a little afraid to use the word holistic healing, but I'm very particular, Indian Medical Association is very consciously, we are promoting the word, the holistic healing, because unless we get that comprehensive healing, that will not be able to get a positive impact on the health in the society. So I am on behalf of Indian Medical Association, I extremely thank the organizers for arranging this program and inviting me to be with you. It is we endorse this entire program of mental health, and whatever way that we would like to be part of you and do the propagation of this good concept to the people. Thank you very much for inviting me to be with you at this moment. Thank you.
A big thank you to Professor Jayalal, and thank you, sir, for giving us time out of your very busy schedule. Ladies and gentlemen, up next we have a personality who is the powerhouse of positivity. He is a consultant psychiatrist who specializes in social and transcultural psychiatry, psychological rehabilitation, and schizophrenia. He is currently a consultant psychiatrist and an honorary professor of Institute of Applied Health Research, University of Birmingham in UK, and a clinical associate teacher at Warwick Medical School, University of Warwick, UK. During his career, he has served on the boards of several prolific organizations, including the Royal College of Psychiatrists, UK, World Association for Psychosocial Rehabilitation, WAPR, and the World Psychiatric Association, WPA. Ladies and gentlemen, please put your hands together for Professor Afzal Javedji, President of World Psychiatric Association. Welcome, sir.
Good morning, ladies and gentlemen, dear friends, office bearers of WPA section on spirituality and religion. I'm so pleased that this particular event is being organized for medical students and young psychiatrists. WPA firmly believes that capacity building is a priority for our future work. And as per current WPA's action plan we are encouraging and asking WPA components to do events that could enhance capacity building, teaching, and training. Similarly, the medical students are the future workforce, not only for the medical profession, but also for health and social sectors. Their exposure and sensitization to know and acknowledge the importance of mental health, as well as understanding different dimensions of care, will certainly improve the future mental health care for our patients. I once again congratulate Dr. Avdesh Sharma and his team for organizing this meeting and highlighting the importance of religion and spirituality within the perspective of mental health. I wish the participants a big success, and unfortunately, due to the COVID situation, I could not be present personally at this important meeting. Thank you very much and all the best.
A big thank you to Professor Javed. Ladies and gentlemen, now it is my utmost honor to invite to address the gathering one of the most decorated and how should I put it? He is the man who transforms the word impossible into the word I am possible. He is an absolute Himalayan range of positivity. Ladies and gentlemen, he is the director and professor and head department of the Pulmonary Medicine and Sleep Disorders at All India Institute of Medical Sciences, New Delhi. He is the first Indian to get decorated with the Decorator of Medicine DM in Pulmonary and Critical Care Medicine. He has done pioneering work in respiratory medicine, the Department of Pulmonary Medicine and Sleep Disorders that has been created under his dynamic leadership in 2011 and has been ranked as the best department in pulmonary medicine in 2014, 2015, and 2016 by the Nielsen survey published in Week. He was conferred with the prestigious Padma Shri Award in 2015 by the President of India and with the Dr. B.C. Roy Award in the category Eminent Medical Person for the year 2014. Ladies and gentlemen, with the thunderous round of applause, I need to hear this round of applause. Please invite and join me in welcoming Professor Randeep Guleria ji. Welcome, sir.
Thank you. Thank you for your kind words. Dr. Jayalal, Dr. Gautam Saha, Professor Chadda, Dr. Sujatha Sharma, Dr. Sanjay Kumar, and Dr. Nan Kumar, who is the sort of, if I may say, the force behind this activity. Delegates, ladies and gentlemen. At the onset, let me really congratulate the Mental Health Foundation of India, who in association with the Department of Psychiatry and the National Drug De-Addiction Center of the All India Institute of Medical Sciences and RAHAT, Charitable and Medical Research Trust, are organizing this 3-day virtual event, which is based on a very important yet sort of less focused theme of unlocking the power of being. And I think this is very, very important. And the fact that it is being looked at from the health professional point of view becomes even more important considering the background of the pandemic that we're going through, which has caused a huge stress and strain as far as health professionals are concerned. As Dr. Chadda mentioned, that already the burden of disease as far as mental health is concerned is significant as per the WHO data. And this is even more when we look at healthcare workers, because of the stress and strain they have to go through, whether it be undergraduate students, whether it be postgraduate students, or even other healthcare workers, the nursing officers, or even faculty, because of the challenges that they face and the expectations that are there from society in today's life. And it's important to understand that health is not merely the absence of disease or infirmity. And that is very, very important. Because what happens is that we as health professionals, or even as health planners or administrators, sometimes are too busy with sort of managing the immediate problems, or trying to manage individuals who have health issues or who are sick, without really looking at those who we feel are well. And that is something that we need to keep in mind, that just the fact that someone is not sick doesn't mean that he is not well. This is also important to keep in mind because, as was mentioned, we are undergoing a rapidly changing social and cultural environment that we are seeing in society. The technology that we're seeing in terms of Facebook, Instagram, WhatsApp messages, the internet, has changed the entire paradigm of what was available before in terms of social interaction, in terms of what is available, and how the younger generation interact to various things that come out in the social media. So it's something that we need to keep in mind. And there is a lack of clear concept or adequate evidence for what we should do as far as providing preventive health or promoting health in such a population is concerned. And that is why I think this 3 days virtual seminar or webinar on unlocking the power is very, very important, because this focuses on spirituality. And spirituality is something which has been in our tradition for many, many centuries. And yet somehow we seem to have sort of lost the way over the last few decades, if I put it that way. When you talk to the younger generation about spirituality, they think spirituality is something about people going to the mountains or going to places like Haridwar or Rishikesh, or it's something that should be done at an older age group and younger people don't need to bother about spirituality. They don't understand that spirituality itself is a way of life which has to be adopted from the very beginning. It has nothing to do with one's religion. It has to do with a lot of how you think and how you can look at your own well-being and really understand how you can improve the quality of your life, which is more than just the materialistic gains that you're looking at. And that, I think, is something that we need to really make the younger generation understand. Somehow that has not been done and it's not become part of our education system. The education system has shifted from how many marks an individual gets, how many toppers the school has, rather than looking at how much values we have taught the children in that school. And the education system and the, let's say, society has changed to looking at who gets a bigger pay package rather than looking at who gets a better quality job and who is more happy or full of joy rather than who is actually going with a high package but looking at a burnout at a very early age and having a very poor quality of life. I think we have somehow lost all of that in the last few decades, and we really need to relook at that if we want to really have healthy citizens in our country and even healthy workforce, especially healthcare workers. And therefore, I think that there is a need to create a supportive environment for everyone, for school children, for students, undergraduates and postgraduates, to really understand what spirituality is all about and how it should become a way of life. There has to be strengthening of community action. And that's why I'm very happy that this is in collaboration with the Mental Health Foundation, with RAHAT group, because they can reach out to community and develop community interactions, because that's where the biggest difference is going to be. And finally, we have to reinvent what we mean by health. And that is something that has to be done in a holistic manner. Because currently the whole focus of health is more towards treatment rather than prevention, and more towards physical health rather than looking at mental health. And we don't really understand the importance of the mind-body connection. You have to have a healthy mind. You have to have positive thoughts if you need to have a healthy body. I think that is something that is very, very important. And I think this 3-day virtual event that is being done will probably address all of these issues and help a lot of people to unlock the power that they have in healing themselves. So I wish you all the best, and I'm sure you'll have a very enriching experience. All the best to the entire group. Thank you very much.
Once again, a big thank you to our Director AIIMS New Delhi, Professor Randeep Guleria ji. Thank you for those very enlightening words. And sir, keep smiling.